Why does sciatic pain, that pain that travels down your leg, actually a spinal problem? So this is a question that I get quite frequently here in our office. And what I want to do is just kind of go through some anatomy and physiology so you understand, exactly why you're getting that pain down the leg, but it's actually coming from the spine. So when we look at the nervous system, it's your brain, your spinal cord, and all the nerves that come out. So it causes your heart to beat, your lungs to breathe, stomach to digest. Now, when we go down that spinal column, we go to that lower back. Those nerves traverse out, and they not only go to the digestive tract, reproductive tract, but we do have a big nerve that traverses out called the sciatic nerve. Now that nerve goes all the way down to the legs and into the toes. It actually splits in the back of the knee, and it goes to different areas of that foot, not only for sensation, but also muscular function, proprioception, balance, all of those things. Now, the reason why we have to go back and trace where that nerve is being compressed is it's kind of like a rope. Okay, it comes out that spine, down the leg, goes behind the knee, splits off, and then it goes back there. So if there is numbness and tingling in the foot, pain in the calf, back of the leg, the butt, or even the back, we actually have to trace that nerve and see where that compression is coming from. So if we do our diagnostic testing, we look at the foot, we look at what's called the tarsal tunnel, we look at fibular head, which is the outside of the knee. We look at the back of the knee. We look at what's called the piriformis, where the sciatic nerve dives deep underneath that. Trace it back up to the spine, where it originates off of that spinal cord. Again, we have to be detectives to see where that is at. So let's say that we're tracing that nerve, we're doing our testing, and we find that it is coming from that lumbar spine. The best way I can explain it is it's almost like we're stepping on a hose and we're not getting that flow out down that nerve. So the problem is in the back, but the symptoms are down into the leg. So if all we do is we ice your foot or the back of your leg or your hamstring, you're really just kind of chasing symptoms, and those symptoms are due to compression in the spine. So again, for us as doctors, we have to be detectives, trace that nerve, figure out where that problem is. But if you are having that numbness and tingling down your legs, one of the things that we might need to look at and try first is address the spine.